Okay, we're going to go through some joint movement terminology now. I know that from what you guys have said to me in the past that this is quite a hard one to stick. So rather than just reading the descriptions, I thought I would demonstrate the movements to help you. So let's start with flexion and extension. So with flexion extension, this is where the angle at a joint decreases and increases. So flexion is the first one. So if I'm doing a bicep curl, I'm lifting the bar up, and as the bar's coming up, this angle's getting smaller, so this is flexion. When I lower the bar down, that's extension. So I've got elbow flexion, elbow extension. The same if I'm doing a front raise. Now, this is a tricky one. The angle at the joint we're referring to as here. So between my head and my shoulder, this angle is getting smaller. So as I'm bringing the dumbbell in front of me, this angle is getting smaller. That's flexion, shoulder flexion. As I'm lowering it down, that's extension. So flexion and extension, remember those two. We've got another version of flexion and extension. We've got lateral flexion and extension. So with a lateral flexion extension, lateral is referring to sideways, so it's sideways flexion and sideways extension. And we can do that with the neck. So if I drop my head down to the side, this angle here is getting smaller. That's lateral flexion. When I bring my head up, this angle here is getting bigger. That's lateral extension. Same if I've got a pair of dumbbells and I'm doing some side bends as I go down to the side. That's lateral flexion. As I come up, lateral extension. There's another flexion and extension. There's horizontal flexion extension. Now this is referring to flexion and extension but in the horizontal plane. So if I bring my arm across the horizon, this angle here is getting smaller. That's horizontal flexion. So think about grabbing a couple of handles on the cable machine and bringing them together. So you've got your pec flies. That's horizontal flexion. Now when I return those back, that's horizontal extension. So we've got flexion, extension, lateral flexion, lateral extension, horizontal flexion, horizontal extension. Now let's just talk about the shoulder girdle. So we've got a few different movements here, all controlled by your trapezius or your traps. Or mainly controlled by those, I should say. So if I lift up my shoulders, both together, as high as I can, that's known as elevation. If I drop my shoulders down, that's depression. That is called depression. Elevation, depression. If I bring my shoulders forwards, that's called pronation. If I bring my shoulders back, that's retraction. So we talked about retraction before when we were talking about correcting somebody's kyphosis. So with a kyphosis, your shoulders are protracted. So then we retract them to correct the kyphosis. So one more time, elevation, depression, protraction, retraction. Then we've got two other words, abduction and adduction. And abduction is referring to coming away or taking away from the midline of the body. So if I take my arms out to the side as if I'm doing a lateral raise, that movement from there to there is abduction. The way to remember it, the way I remember it, is I imagine an alien's abducting my arm. So if an alien was to abduct my arm, they'd take it away, so that abduction. I don't often imagine things to do with aliens taking my body parts away, just occasionally. So abduction, taken away, and then as my arms come towards me, it's the opposite, which is adduction. So it's the difference in the word is one letter. It's swapping a B for a D. And with adduction, I think of adding too, so adding towards the body. You could do the same with the legs. You know, if you remember the old multi-hip adjustment machine, I don't know if any gyms still have those, but you put like a pad inside your thigh and you could bring your leg towards you, or you put it on the outside of the thigh and you could take your leg away from you. Well, as you take the leg away, abduction. When you bring the leg towards you, adduction. The same words. So that's abduction, adduction. Now we've also got another area where we have flexion extension, which I almost forgot about, is in the hip or in the lower body. So we've got flexion, extension. So as I bring my knee up, this angle gets smaller. When I take my leg back, this angle gets bigger. So we've got hip flexion, hip extension. We've got the same thing going on in the knee. As I bring my heel behind me, this angle gets smaller, that's flexion. When I straighten my leg, that's extension. So knee flexion, knee extension. When you're doing the seated leg extension machine or the seated leg curl, you've got flexion extension. With the leg curl, where you're working the hamstrings, it's all about that flexion and then controlling it back. And then when you're sitting down doing the leg extension, it's extension and then controlling it back with the flexion. What else we got? Circumduction. Circumduction is cone-shaped circular movements. So when I'm swinging my arms around there in circular motions, that is circumduction. Quite often people get that one confused with rotation. So it's not rotation, just think about circular movements. You do the same with your legs, that's circumduction. Circling your hips, circumduction. Rotation is quite different. It's rotating something on its own axis. So my arms, if I rotate them like that, that's rotation. If I look left, right, that's rotation. If I turn my torso round, that's rotation. You know, I can rotate my leg as well, inside and outside. So that's your rotational movements. Now we've also got one specific, it's a form of rotation really, but specifically to your hands or your forearms. If I turn my palms up, then that's called supination. If you turn your palms down, then that's called pronation. This is quite a useful one to remember because often you have supinated grips and pronated grips. And the easiest way to remember it is, well, first learn what supination and pronation is, that helps. But a sneaky little trick is where you bring your hands together and you make a soup bowl. And I mean, that's not how I drink my soup normally. I normally have an actual bowl, but if you didn't have a bowl, you'd bring your hands together and you have a soup bowl. And that's supination, a supinated grip. Pronated is just the opposite, so that's that way round. So you could have a pronated grip. You're doing like pronated chins or something. So that's supination, pronation. We're not done yet, there's still more. We'll go down to the feet, and we've got some different movements going on with the feet. We've got, and I never really understand why they don't just call this flexion extension of the ankles. It'd be much easier, but again, they've got to make things more complicated. If I point my toe, that is called plantar flexion. If I bring my toes towards me without falling over, that is called dorsiflexion. Now, I don't know why they don't just say, look, that angle's getting bigger, so that's ankle extension. That angle's getting smaller, so that's ankle flexion. But they don't. It's plantar flexion, dorsiflexion. Then with the feet, we can also turn them inwards and we can turn it outwards. Not very well, but I can just about. Now, when we turn the foot inwards, that is inversion. When we turn it outwards, that's eversion. So there's 4 movements in the feet there: plantar flexion, dorsiflexion, inversion, eversion.